Chapter 8 Nanoelectronic Imaging Techniques in Medicine. Nanoelectronic imaging techniques have emerged as powerful tools for visualizing biological structures and processes at unprecedented resolutions, providing invaluable insights into disease mechanisms, diagnostics, and therapeutic interventions. This chapter explores the diverse landscapes of nanoelectronic imaging techniques in medicine, from microscopy to medical imaging modalities, highlighting their principles, applications, and potential to advance healthcare. Imagine being able to see inside the human body with unprecedented clarity and detail. Welcome to the world of nanoelectronic imaging techniques, where advances in nanoelectronics are pushing the boundaries of medical imaging and diagnostics. Nanoelectronic imaging techniques leverage the principles of nanotechnology and electronics to achieve high resolution imaging of biological samples and tissues. These techniques utilize nanoscale probes, detectors, and imaging platforms, often integrated with electronic components such as sensors, actuators, and signal processing circuits, to capture and analyze images with exceptional detail and sensitivity. Several nanoelectronic imaging modalities are employed in medical research and clinical practice. That includes, first, scanning probe microscopy. Techniques such as atomic force microscopy and scanning tunneling microscopy enable nanoscale imaging and manipulation of biological samples with submolecular resolution, offering insights into cellular structures, surface topography, and mechanical properties. Second one is fluorescence microscopy. Nanoparticle based contrast agents and quantum dots facilitate fluorescence imaging of biological specimens with enhanced brightness, photostability, and multiplexing capabilities, enabling visualization of cellular processes and molecular interactions in real time. And third one is super resolution microscopy. Nanoelectronic super resolution microscopy techniques such as stimulated emission depletion microscopy and single molecule localization microscopy surpass the diffraction limit of conventional optical microscopy, enabling visualization of subcellular structures and dynamic processes with nanometer scale resolution. Nanoelectronic imaging techniques find diverse application in medical imaging also. First, diagnostic imaging. High resolution nanoelectronic imaging modalities aid in the early detection and characterization of diseases such as cancer, cardiovascular diseases, and neurological conditions, facilitating accurate diagnostics and treatment planning. Second, intraoperative imaging. Intraoperative nanoelectronic imaging technologies provide real time visualization of surgical sites and tissue margins, enabling precise guidance of surgical interventions and minimizing damage to healthy tissues. Third is molecular imaging. Nanoparticle based contrast agents and molecular probes enable non invasive molecular imaging of biological processes such as angiogenesis, that is, development of new blood vessels, apoptosis, that is, programmed cell death, and inflammation, offering insights into disease progression and treatment response. Nanoelectronic imaging modalities represent a significant advancement in medical research and clinical practice, leveraging nanotechnology to enhance the resolution, sensitivity, and functionality of imaging techniques. These modalities enable detailed visualization and analysis at cellular and molecular levels, which is crucial for early diagnosis, disease monitoring, and tailored treatment strategies. Here are some prominent examples of nanoelectronic imaging modalities. First, quantum dots in fluorescence imaging. Quantum dots are semiconductor nanoparticles that exhibit unique optical properties, such as size tunable fluorescence and high brightness. In medical imaging, quantum dots are used as contrast agents in fluorescence imaging techniques due to their stability and resistance to photobleaching. Their application includes cellular imaging and tumor detection. Quantum dots can target specific cellular structures or molecules, allowing for detailed visualization of cellular processes and molecular interactions. Also, in tumor detection, quantum dots conjugated with targeting ligands can bind to cancer specific markers, enabling the precise localization and imaging of tumors. Second nanoelectronic imaging modality is nanoparticles in magnetic resonance imaging, that is MRI. Magnetic nanoparticles, particularly iron oxide nanoparticles, are employed as contrast agents in MRI to improve the contrast of images. These nanoparticles enhance the magnetic properties of tissues, making it easier to distinguish between normal and abnormal structures. Its key application includes cancer diagnosis and tracking stem cells. In cancer diagnosis, super paramagnetic iron oxide nanoparticles are used to enhance the contrast of tumors in MRI scans, aiding in the early detection and characterization of cancer. And in tracking stem cells, nanoparticles can label stem cells, allowing researchers to track their distribution and integration in regenerative medicine applications. Now, third example of nanoelectronic imaging modality is carbon nanotubes in NIR imaging, that is near infrared imaging. Carbon nanotubes, that is CNTs, have unique electronic and optical properties that make them suitable for near infrared imaging. In medical applications, CNTs are used to deep tissue imaging and photothermal therapy. In deep tissue imaging, the near infrared region provides deeper tissue penetration with lower background interference, enabling the imaging of tissues and organs located deeper within the body. In photothermal therapy, CNTs can be used for both imaging and treatment. They absorb NIR light and convert it into heat, which can be used to selectively destroy cancer cells. Fourth nanoelectronic modality is gold nanoparticles in computed tomography, that is CT scan. Gold nanoparticles are excellent contrast agents for CT scan due to their high atomic number, which provides strong contrast enhancement. Its application includes tumor imaging and angiography. Gold nanoparticles can be functionalized with targeting molecules to bind specifically to tumor cells, enhancing the contrast in CT scans and aiding in accurate tumor detection and localization. In angiography, gold nanoparticles can improve the visualization of blood vessels, helping in the diagnosis of vascular diseases and conditions. Another nanoelectronic imaging modality is nanoscale biosensors in optical coherence tomography, that is OCT. Optical coherence tomography is a non invasive imaging technique that uses light waves to take cross sectional images of tissues. It is commonly used in medical fields such as ophthalmology, cardiology, and dermatology. Nanoscale biosensors integrated with optical coherence tomography, that is OCT, can provide real time, high resolution imaging of biological tissues. These biosensors are used to monitor disease progression. Nanosensors can detect specific biomarkers associated with diseases, allowing for the monitoring of disease progression at a molecular level. Also, biosensors are used for guided biopsies, OCTs combined with nanosensors can guide biopsies by providing detailed images and identifying areas of interest for sample collection. And last but not the least, nanodiamonds in ultrasound imaging. Nanodiamonds have unique properties such as excellent biocompatibility and the ability to enhance ultrasound contrast. They are used in drug delivery monitoring and molecular imaging. Nanodiamonds can be loaded with therapeutic agents and tracked using ultrasound imaging to monitor the delivery and release of drugs at target site. Also, in molecular imaging, functionalized nanodiamonds can target specific molecules, providing high contrast images of molecular interactions and aiding in the diagnosis of various diseases. Nanoelectronic imaging modalities are transforming medical research and clinical practice by providing unprecedented levels of detail and specificity in imaging. These advanced techniques not only enhance diagnostic capabilities but also open new avenues for targeted therapies and personalized medicine. The continued development and integration of nanotechnology in medical imaging hold great promise for improving patient outcomes and advancing healthcare. Despite their tremendous potential, nanoelectronic imaging techniques face challenges related to instrumentation complexity, sample preparation, and data analysis. Further advancements in nanomaterials, device design, and computational imaging algorithms hold promise for overcoming these challenges and further enhancing the capabilities of nanoelectronic imaging in medicine. Looking ahead, the integration of nanoelectronic imaging techniques with emerging technologies such as artificial intelligence and biocompatible nanomaterials is poised to revolutionize medical diagnostics, personalized medicine, and therapeutic interventions. By pushing the boundaries of imaging resolution and sensitivity, researchers and clinicians are paving the way for a new era of precision healthcare, where early detection and targeted therapies improve patient outcomes and quality of life. Thank you.